Senator Kaine. Senator Hassan.
Well, thank you, Mr. Chair and Ranking Member Murray, for this hearing as well as the last three that we've had. And thank you to all the witnesses, not only for being here today, but for what you do. It's incredibly important. Most of the questions I had have been asked. Ms. Postolowski, I wanted to follow up with you on the issue of copper plans, because you've talked a little bit about how high the deductible would be in relationship to the median income of young invincibles. But one of the other things I noticed in your testimony was that you also talked about the idea that those copper plans could be supplemented, or catastrophic plans could be supplemented by HSAs. And I think in your testimony you said in order for a young invincible to make up that deductible difference through an HSA, they'd have to save something like $632 a month. Is that right?
I know it would be $9,000 for the deductible.
So they'd have to. So you'd need a young person whose median income, according to your testimony, is around $20,000 a year to be able to save $632 a month to make up that deductible over the course of a year. The reason I point that out is that I think it's really critical that as we have this discussion about health care, that we understand how things actually would play out on the ground for the people we're trying to serve. The founding principle of this country is that every single person counts. That's why what we just heard from Senator Kaine was so real, is that we're not going to tolerate people in our states not being able to get health care. Every single person counts. That's the basic foundational principle of our democracy, and that means every single person has to be able to get health care. And so as we look at the debate we're having, I also think it's really important that we understand that health care is not like any other consumer product. I can choose not to go to a restaurant or have the most expensive thing on the menu. I can choose not to take vacation and save money that way. But nobody plans to get sick, and we don't say, oh, gee, that essential benefit's been waived by my state, so I just won't get mental illness. Nobody plans to get substance use disorder, but people in my state are being ravaged by it. And boy, has the fact that substance use disorder is an essential health benefit been absolutely critical to our capacity to try to address this terrible epidemic. So as we move forward, I think it's really critical for us to think about that. I think it's very critical for us to think about, as compelling as Senator Paul's remarks about the group plans were, every group plan I know relies on employers paying an awful lot of the cost of the premium that actually plays out, which is why when people terminate their employment in a group plan, they often can't afford the cost of COBRA, because that's the actual cost of the plan that the employer was helping to subsidize. We have to understand how this plays out, and ultimately we have to figure out a way to make the innovations and discoveries that have made 21st century healthcare in this country so remarkable available to people. We have to provide incentives, as we try to do in New Hampshire, through transparency of cost and outcomes, so that people can understand that sometimes lower costs can actually be aligned with better health outcomes, something that I do not think is intuitive for most people, who think if you say to them, hey, please go use the lower cost provider, that they're somehow going to get worse care. Ultimately, in my state, the business community came together, for instance, and supported Medicaid expansion under the Affordable Care Act and convinced a Republican legislature to reauthorize it, because they know that when people don't have the access to get the health care they need at the front end, ultimately they end up in emergency rooms, in great crisis. They get the care because we're the United States of America. We are going to give our citizens in healthcare crisis care because everybody counts. But ultimately that cost gets shifted somewhere else, and the private insured through their employers end up paying greater health care costs. So I hope, as we work to stabilize the markets right now with cost-sharing reductions, with, I hope, federally at least seeded reinsurance plans, I hope that we also then move on to a discussion about how we continue to get our country healthier lowering costs so that all of us can thrive together, that we can have a workforce that is competitive in the 21st century economy, and that we can make sure that all Americans have the opportunity to enjoy the quality of life that we'd all like to have as healthy citizens. Thank you all very much.
Thank you, Senator Hassan. I want to acknowledge Senator